We need to build a stronger European health union. It is time to do that.
These were the words of the European Commission President on Wednesday during her maiden State of the Union speech. With the continent still reeling from the biggest public health crisis in generations, the timing could not have been better. But what does this actually mean for the European Union? Included in her pledge is the idea to strengthen the EU's medicine and disease control agencies, whilst also enhancing Europe's capacity to respond to any future cross-border threats.
Between member states, we will build a European BARDA, an agency for biomedical advanced research and development. This new agency will support our capacity and readiness to respond to cross-border threats and emergencies, whether of natural or deliberate origin.
A new agency could also help the EU to respond better to the next public health crisis.
I believe we need to build something bigger that can really be more quicker and also be able to help the member states even more than today.
But the idea of a European health union isn't a new one. It has just taken a global pandemic, which has seen the shutting down of borders and economies, to bring it to the forefront of the EU's agenda. The idea of member states working together and pooling their own resources to fight a deadly disease is one that is now gaining traction.
The very important things is that we share the knowledge and the data that we have, that we make sure that our research centers that are on a national level really work together, and that in that way we take a stance against the big pharmaceutical companies.
Von der Leyen has also pledged to team up with the Parliament to ensure that the EU for Health programme, the EU's response to the COVID-19 pandemic, is strengthened after it was dramatically cut by member states from the budget.
We need to make our new EU for Health programme future-proof. And this is why I had proposed to increase funding, and I'm grateful that this Parliament is ready to fight for more funding and remedy the cuts made by the European Council.
The Commission President's plan is ambitious, but in the wake of the pandemic, the time for a European health union may have finally arrived. Christopher Pitchers, Euronews, Brussels.